Perfect. Now we're on. So, welcome everyone to our Where Next webinar. My name is Candela Iglesias, and I'm the founder and director of Alanda Health. At Alanda, we aim to support organizations working in global and public health with all their evidence and training related needs. We also have what we call our internal projects. And one of our internal projects is around supporting young public and global health professionals with their career development needs. This webinar is part of that project, and so we're very happy to have you here. I do want to start by acknowledging that we are living through some very hard times in global and public health. You probably have all heard about the big freeze in aid spending concerning global health and the US aid agency. So, that is a little bit the background that we were not expecting when we planned this webinar back in January. So I am conscious that a lot of people might have been affected by it. I don't have all the answers, but I'm happy to try and provide some of the answers I have. With that said, let's do a little bit housekeeping. If you can, please, any questions that you have that you would like me to answer, type them into the questions, into the Q&A chat. Anything else, feel free to type into the regular chat. If this is too confusing, just type them into the chat. We'll figure it out. I have my fantastic team today here with me. Julius, Sophie, and Ola are all part of Alanda. They're here today to support and to try and help me answer any questions that are easier to answer or that just requires links and so on in the chat. People have been saying hi in the chat and telling us where they're joining from. A lot of people from London, some from Innsbruck, some people joining from New York. Feel free to type in the chat. Because of the webinar settings, our only way of communication is through the chat. So let's use that to the max. And I want to talk a little bit of what the agenda is going to look like today. I'm going to try to cover 3 of the most common questions I get from young public and global health professionals. And these are, what are my career options outside of academia? Especially if you're still a student doing a master's program, it seems like academia looks like the only track. But of course there's not, and there's a variety of things, and I'm going to be talking about that. The second question I get more often is, should I do a PhD? This is a very personal question, but I'm going to try to give you some tips on how to address this question, how to think about this question for yourselves. The third question is, why do I keep getting rejections or no answers to my job applications? What am I doing wrong? And I'm going to provide you with a completely different view on how to go about getting yourself recruited to a job. So hopefully this will, shift a little bit your vision on where you should be focusing your attention for landing your first job. And then we'll have quite a bit of time to answer your questions. And at the end, I'll speak a little bit about some other guidances and resources that we have put together at Alanda, and a course that we offer and that we offer for young public and global health professionals who are aiming to land their first job in global and public health. Because of the current circumstances, we are providing sponsored seats for everybody that needs it. So we'll talk a little bit about how that works as well. So with all that said, I hope you're still saying hi in the chat. People joining from Nigeria, Godwin joining from Nigeria. There's Divya joining from Norway. Hey, I spend half of my time in Norway as well. That's great. People joining from India, from the Netherlands, from South Africa. This is so international. I love it. Fantastic. Okay. Can we start with a little poll? I would love to get your answers to these questions, and hopefully you're able to just click on your screens. Are you a master's student in global or public health, a master's student in another area? Are you a young professional in global or public health or another area? Are you more of a more seasoned professional with more experience? I see that there's answers coming in. Thank you so much. And then I'm trying to understand how many people have been affected by the global health spending freeze, because that's also important information how we're going to move forward with, sharing Ananda's resources, etc. And whether you're looking for a job in global or public health right now. That's great. Thank you. I'm going to wait a little bit to see how the answers are coming in. I have about half the people have answered already. Okay. So most of our participants are currently studying a master's in global or public health or in another area. That's great to know. And have you been affected by the global health spending freeze? About 26% of people have not been affected. 19 have been affected, and many are not sure or not sure yet. And then the majority of you are looking for a job in global or public health right now. So we're going to try and focus this conversation on that. Thank you so much for answering. I'm going to end the voting now so we can move ahead, but this is very useful for us. Perfect. I'm going to close this and I'm going to go back to the presentation. Okay, let's talk about that first point. What are your career options outside of academia? And when you're master's students, it can feel a little bit like the only options are, continuing and doing a PhD or become a research assistant, etc. The reality is there's a lot of options out there. So you can continue to build a career in academia, and we'll talk about how, if you want to do that, a PhD might be your best next step. But there's also a variety of organizations that need the skills of a global or public health specialist, or someone with interest in global or public health, even if your diplomas are related to some other health area, or even to some other area or other sector. What are these organizations? Let's divide them by type. Let's start with government. So governments recruit public health professionals to work both in public health, so within the country, but also some countries also recruit global health professionals to work in international aid programs, okay? In government, when you think about jobs, you need to think about the whole hierarchy of jobs that go from the very local level, at the municipal level, at the community level. You might have structures from the government for global or public health. They might be related to surveillance. They might be related to epidemiology. They might be related to community health. They might be linked to primary or secondary healthcare facilities. But you have all these structures that have government positions where they need people with public health skills, with epidemiology skills, with community health skills, with health communication, health advocacy skills, etc. Then you have, of course, jobs at the state or, depending on the structure of the country, at the state level or at the district level or at the province level. And then, of course, at the national level. And these can be in institutions such as the Ministry of Health, but many countries have a National Institute for Public Health that might be dependent directly on the Ministry of Health. In some other countries like Mexico, it's the National Institute of Public Health is more of a academic structure that is not directly dependent to the Ministry of Health. So the settings vary, but there might be a surveillance organization more focused on epidemiology and surveillance. The CDC in the United States is an example, for instance. So you have all these jobs and positions within the government. Now, briefly, there's a lot of advantages for working with the government. It usually, if you get a for life position, you have a lot of job security. Not always you will get a for life position, especially in these days, but it is possible. And there's also the advantage that you can make a big impact, right? Especially if you're working at the national level, for example, in policy, or you can, the impact that you can have can be quite large. Because that might be applied throughout the whole country or throughout the whole district or throughout the whole state or municipality. The disadvantage tend to be that salaries are not very high. It varies from country to country, of course, but in government compared to other organizations, salaries might not very, very high. Then, apart from government, we have not-for-profits, NGOs, non-governmental organizations that go all the range from the smallest, most local community-based organization or faith-based organization to the highest level, the biggest international NGOs that have chapters all over the world. Of course, I can't know the names of all the small and local organizations, but there's a lot of them, and they're always happy for more hands and more brains. So it's tends to be easy to join as a volunteer as a first step to being hired. And then international organizations tend to have country chapters or country offices and regional offices as well. So there's all these variety of jobs that exist at all these levels. And of course, there's national level NGOs that exist only in one country or maybe in a few countries in the region, so that they're smaller than this big international NGOs, but they can still have they're much more professionalized and can have a lot more job options, okay? So NGOs are always a good idea. Again, unless you're in a big international NGO, salaries are not on the high end range, but you can have a direct impact because you can actually be working in implementation. So the smaller the organization, the larger the chances that you're actually working in implementation. Of course, there's also NGOs that work in advocacy, in pushing health policy, etc. So there's a wide variety of things that you could be doing in an NGO depending on your interests. One thing that most NGOs are not very good at, and where I think us as global and public health professionals can bring a lot of value, is when it comes to research. And I'm not talking academic research, just operational research. How do you collect good data? How do you develop good monitoring and evaluation, etc.? That's one of the things that Alanda specializes in. And it actually tends to be a gap for most NGOs. So if you have good research skills, you can always, get to know the local or country NGOs that you're interested in and say, hey, I have these skills. This is what I can help you with. That can be a really good point of entrance. Then we have all the what we call the multinationals, and first and foremost, of course, all the UN bodies. So those that normally have work in global or public health, of course, are the World Health Organization, which you all know about. But there's others that also will also recruit global or public health skills or epidemiology or similar skills. And that can be UNICEF, for example. It can be UNDP that does a lot of work in family planning and sexual and reproductive health, for instance. But even other UN organizations that you might not sort of think about as related to health can have global or public health positions. So make sure to check them all out. It tends to be higher level work. It's never going to be very sort of implement based. It's more technical advice. It's more, tends to be more at the global level or at the regional level. Of course, there's positions in country. WHO and UNICEF in particular have offices in a lot of countries in the world. So there's also possibilities there. So, of course, there's a lot of positions here. They're very competitive. They tend to be very competitive. But there's also the possibility to join, first as an intern or as a consultant, etc., and sort of opening the door to understanding more the organization, the UN organization, and then taking your next steps. That said, the UN is not the only one, okay? There are other multilateral organizations that you can think about that also do work in global and public health and need our skills. Think about the development banks, starting from the World Bank and the IMF, but you also have the regional development banks in each of the regions of the world. So go look at those and see what they have. There tends to be less competition there because they're not necessarily thought about as bodies that focus a lot on global or public health. You also have organizations such as Gavi, which is also multilateral. You have today the new kid on the block from some years ago, pre-pandemic, is CEPI, the Coalition for Epidemic Preparedness Innovation, which is based in both London and Oslo in Norway. And of course, you have the Global Fund for HIV, tuberculosis, and malaria that has a lot of positions worldwide. It has chapters, it has teams in several countries. So there's a lot of positions there, also a lot of consultancy opportunities there and that are interesting for you. And then we have the foundations. Let's talk about the private world. In the private world, we have the not-for-profit, sort of the foundations that provide funds for implementing agencies, which tend to be, could be governments, could be NGOs, could be, etc. And those foundations, there are a lot of foundations around the world, especially in the high-income countries. And that work might be more, related to grant management, to technical advice, etc. But there's definitely positions for people like us there. And there's also, in the private sector, there's all the biopharma organizations that need people with skills related to public health, epidemiology, research, disease modeling, etc., etc., etc. So even if you're not a wet lab person, if you're not a biomedical researcher, there are positions within the biomedical private world, pharmaceutical companies, companies that build equipment, companies that build technology, companies that build digital products that are a good opportunity. Now, when we think about the private world, we tend to think about this big organizations, these big pharmas, etc. The reality is there's a lot of opportunities across the spectrum in size, okay? So there's a lot of small startups that will need your skills. So startups are companies that are just being put together, that are on their very first years, okay? The lovely thing about startups is that they're eager for talent and that you can wear a lot of hats because they will need you to do a lot of different things. So if you're a very curious person, that's a great environment to be in. They might not pay as nicely as you would get paid for in a big pharma, a big pharmaceutical company, but the work you do might be more interesting for you. So also look at those positions. And there's many countries in the world today where there's big startup ecosystems, especially around health and health tech. So your skills might be needed there. So go find those ecosystems. And then, of course, there's all the variety of consultancies and technical assistance organizations that are private in nature, whether they're for profit or not for profit, where we provide skills to other organizations as consultants, as technical advisors, as for specific projects, to carry out specific projects, to carry out specific pieces of research. There's a variety of consultancy or technical advisor organizations, think tanks, etc. And they exist in many countries in the world. So you can also look for these. And they tend to be a little bit more flexible, I would say. Some are even very willing to recruit for remote positions. So take a look at those as well. So those are a little bit of the types of organizations you should be thinking about apart from academia. I haven't touched upon academia because it's probably what you know best. Okay, if you have any questions about that, type them into the chat and we'll get to those later in the presentation. Hello to all the people who have just been joining, and see some people joining from India, South Africa, and Somaliland. Welcome everyone. Some people joining from the US, Brilliant. Let's go on to the second question. Should I do a PhD? I'm not going to tell you what to do. That's my first answer. But I can help you think through that question for yourself. Who in global and public health actually needs a PhD? If you are going to stay in academia, if you want to be a professor, if you want to be a researcher, most likely at some point you will require a PhD. That doesn't mean you need to do it right now after your master's. Okay, so think about it. You might take a couple of years break to see where you want to go. You might take a couple of years break to work, to figure out what are the themes that interest you, and then go back and do a PhD if that's what you want to do. If you're going to be working in an NGO, in a biopharma, in the private or not-for-profit world, for foundations, if you're going to be working in implementation, if you're going to be working in health policy, you might not in an advocacy, in grassroots or community efforts, you might not need a PhD at all. You can still do one if you want because you're very curious about research, but you might not need it to actually get a job. So take a look at the jobs that you're interested in and see if they actually require a PhD. In some cases, especially in research-related positions, a PhD or equivalent experience might be sufficient, okay? If you're wanting to, get into WHO and climb very high the ladder, then a PhD might be necessary. Even if you don't really need it for your job, you might need the title, the PhD title, to break through the ranks, let's say. But think very carefully about whether you want to invest 3 to 4 years of your life in doing a PhD. Really think about where you want to go with your career before taking that decision. It's great to do a PhD. I have one. It's not a problem. But do it for the right reasons, because you really are curious about research. You want to delve into a specific question in detail. You want to have time to think about a subject in depth. You want to become an expert in that subject. Those are all very good reasons. If you don't like research, then don't do a PhD, unless you really want to push through your own areas where you want to grow. But think carefully about why you want to do a PhD before just jumping into one. And I understand that in some cases, it might be because there's also other good reasons for doing a PhD, right? If you want to stay in a country where you don't have a visa unless you continue your studies, that might be a very good reason. If you want to, continue exploring certain areas, certain technical areas, that might be a very good reason. So that's fine. Just be very clear on why are you choosing to do a PhD, because it requires a big commitment of time and effort. So make sure, you make that decision very consciously. Hi, people that are joining from Innsbruck. And MCI, is that the Management Center Innsbruck? Fantastic. Welcome, everyone. Okay, let's move on to question number 3. And I'm seeing that people are posting questions in the chat. I am going to get back to those after I answer this third question. So don't worry, keep typing your questions as they come into your mind so you don't forget them. Okay. Why do I keep getting rejections or no answers to my job applications? This question relates to how do I think differently about my job hunting. This is how I think about job hunting. Jobs are like an iceberg. You know, an iceberg, the majority of the ice is actually underwater. You can't see it. The minority of the ice is above the water and is the ice you can see. Jobs are like an iceberg in the sense that the jobs that are advertised are a tiny fraction of all the jobs that exist, of all the job positions, of all the positions that exist. What do I mean by this? I mean, if you're going into, Glassdoor or Impact Hub or whatever platform you're using, or Relief Web, whatever platform you're using to look for jobs, the only jobs that you're seeing are the jobs that are being posted. And a big chunk of jobs, in many cases, the majority of jobs, are never being posted. This is because they're being filled internally throughout the organization. Many organizations first advertise internally and then they post out their positions if they don't find a suitable internal candidate. It might be jobs that didn't exist, and then the organization thought, oh, actually, we really want to keep this person. Can we create a job for them? It might be that, all of a sudden they have a specific need and they bring in a consultant that they already have worked with in the past. Okay, so all of these are this hidden jobs, the jobs that are underwater. And if you're only looking at the jobs that get advertised, you're not seeing these jobs. So you're missing out on the majority of jobs out there. Not only you're missing out on the majority of jobs out there, the majority of people applying for jobs are using the same technique, just applying for the jobs that get advertised on that top, that top part of the iceberg that is visible. So you have a big chunk of job opportunities that are hidden from view and all of the people crowding on the top of the iceberg. Okay. Now you're saying, okay, that's all very nice, but how do I even hear about these hidden jobs? How do I even hear about the jobs that are never advertised? This is where you need to start working on your relationship building. And I'm going to be using the term relationship building instead of networking because some people have very negative associations with networking. Networking can be seen as, I go to one event, I talk to 10 people, and that's my networking. Whereas what I'm talking about is relationship building. And this requires a lot of effort. But if you're willing to put in that extra effort, you will be pecking into the hidden part of the iceberg, the jobs that are never advertised, that people won't hear about on Glassdoor or ReliefWeb or whatever it is. Okay. So it takes time, it takes work, but it really gives you an edge, a comparative advantage, to find a job. How does this work? It can work in different ways. The first thing you need to have clarity is what type of organizations are you interested in? So you need to do your due diligence. You need to look online. You need to understand if you want to work like remotely, if you want to work in your own country, try to figure out which organizations, attract your attention, and try to think about the variety of organizations that I talked about today, right? And what are the plus and minuses of each of those, and which maybe you already know which ones call to you more, which ones attract your attention. Research those, make a list of 5 or 6, not too many. Research those in depth, and then try to reach out to people who work there. Now here's the thing, don't ask for a job. If you ask for a job, people are going to just start running in the other direction. What you want to know, what you want to understand is you want to understand more about the organization. You might want to understand more about a specific team or a specific program or a specific environment within the organization. You're not looking for a job at this point. You're not asking for a job. So you reach out to people, and it's very easy to do today with LinkedIn. You reach out to people that work in that organization and you say, hey, I'm trying to figure out what I want to do next in my global or public health career. I find this organization very interesting, but I find it difficult to understand exactly what programs A and B are actually about from the data on the website. Would you be willing to hop on a 10-minute call with me to tell me more about it and tell me your views about, and tell me how your day-to-day look like in that job or in that organization? Tell me a little bit more about the organization. So here's the thing. You're asking for 2 things, a very small amount of their time, and you're not asking for a job. You're asking for advice. The beauty of this is that most people love to give advice. So if you're asking for a small amount of their time and you have very specific questions, so don't tell me, don't send me an email link and say, hey, Candela, I'm a global and public health student. I need to know where I want to go next. Can you talk to me about Thalanda? Can you tell me about Thalanda? That's too broad. That puts the work on me. And I'm a busy person, right? So don't do that to people that you're reaching out to. Make it easy. Have 1 or 2 very specific questions that show that you've researched the organization in advance. And some people will say no, some people will not answer, and that's okay. But some people will say yes. So once you have that connection, you continue building that relationship. You try to find out what's interesting for the person. You send a thank you email. Then you send an email, or a LinkedIn message a few weeks later saying, hey, I thought back to our talk because you mentioned this and this was really helpful for me because of A, B, and C, or what I did next based on your advice was this and this and that, right? That's already a second and a third touch point if you already sent a thank you email. So now you have 3 touch points with this person and you're building that relationship, right? And then, next time you can send them an article that you found interesting, or you can, just say, oh, I heard about the US aid freeze in spending. I just hope that everything is okay for you and your organization, whatever it is, but keep that conversation going. And at some point you can say, look, if there's interesting positions in your organization, I would love to hear about them. Or if there's internship or volunteer opportunities, then that's okay. But you're asking for that once you've established a relationship, not before. Okay. So don't go asking for a job right away to people that don't know you, because that doesn't normally work. But build that relationship first, show that you can provide value and that you're willing to do the work. And then you're one step ahead of the curve. You're one step ahead of everybody else. Okay. That's very important. And that's one way where you can tap into this iceberg. The other way to tap into this is volunteering or interning. And it's not because there's not an open intern position that they can't create one for you. Okay. But it's also about building these relationships. So again, do your homework, find the organizations that you're interested in, especially if they're very small. They might be very happy for your skills, but don't go knocking on their door and saying, hey, I'm here. Can you, build an intern position for me? Or can I volunteer for your organization? That doesn't work. You need to do the work for them. You need to say, hey, I researched your organization. I see that you're doing this and this and this, but I see that there's not a lot of data in your website, or I see that your Instagram is sort of lacking. I have these great Instagram science communication skills or health communication skills. I'd be happy to, spend a few hours every week helping you to put out information. You come with a solution to a problem. That problem they might have been aware of, or they might not have been aware that they had it. But if you actually manage to click on the right problem and you're actually providing them with a tailored solution, you're one step ahead of everybody else. You are so valuable. You're actually adding value to that organization. I did this many years ago. I joined an organization in Paris called Solincy, Solidarité Enfant Sida. And I said, hey, I have research skills. Do you have data? I can analyze your data and I can help you present it. And if you want to send it to a conference, I can help you send it to the conference. I can write the abstract, etc. I came with a very clear way of supporting them. They might say no, but you have a lot more chances if you're not just knocking on the door and say, hey, tell me what to do. I'm happy to help, right? Come with a solution and you'll be ahead of the curve. That's another way of tapping to the bottom of this iceberg. Because once you are a volunteer, once they know that you're super valuable, that you have all these amazing skills, now you have one foot in the door. And maybe they realize that they can't live without your skills or your solution, and they hire you, or they hire you part-time, or they hire you as a consultant. You might not get the job of your dreams right away, but at least you already have one foot inside that organization and you build your relationships. Okay, last way to tap into the jobs here, and there's many others, but these are the ones I'm going to talk about here. Last way to tap into those jobs at the bottom of the iceberg. Talk to people that you already know. Talk to people in your network and figure out who they know, right? So you just, send to your friends and family and colleagues and your peers from the master saying, look, I want to work in a type of organization that looks like this. Do you know organizations that look like this, that have this size, that work on these programs, that are, small, that work in these countries, whatever it is that you want? And then people can say, yeah, I know an organization like that. Or yeah, actually, I know a person inside an organization like that. And then you have what we call a warm lead. A warm lead is a connection between you and that organization, or between you and a specific person in the organization. And then you can always ask your friend or your family or your colleague or your fellow student, hey, is it okay if I said that you recommended that I talk to them? So you send a message on LinkedIn or an email and say, hey, such and such recommended that I talk to you because I'm interested in understanding more organizations that look similar to the one you work in. Can you tell me a little bit more about how you're structured, what the programs you are working on look like? And, tell me a little bit more about how you what do you like and dislike about your day to day? Give me 10 minutes of your time. Again, don't ask for an hour, please. People are busy. Start with 10, 20 minutes at the most, and people have an easier time saying yes to that. So that's another way. You already have a network. You have a network of people, including your peers, including your other students, including your professors. You don't know who your professors know. You don't know who your student peers know unless you ask them. But to ask, you have to have a specific ask. That's on you, okay? You have to do your due diligence. When you do your due diligence, when you do your homework, when you figure out what type of organizations you're interested in, then you can ask more specific questions. And that's where you get ahead of the curve. I hope this was useful and sort of broke through this thing that, I need to improve my CV a little bit more by 1%, or I need to improve my cover letter a little bit more by 1%. Yes, work on all those things. But if you're only focusing on the tip of the iceberg, on the jobs that are advertised, you're missing out on a lot of opportunities. Just remember that. I'm not saying you don't need to send applications to jobs that are advertised if they're a good fit and they are really interesting to you. But I'm saying also work on building your relationships, because that's how you get to the bottom of the iceberg. Okay? Great. Okay. Now we are going to part 4, and that is your questions. So I am going to go to the chat, and my team is going to remind me of any questions that I'm missing, but I think so far so good. It says, so I think Yavi had the first question, and apologies if I'm mispronouncing your names. Related to the question on should I do a PhD, should I pursue a master's? If you want to work in global and public health, I would say in most cases, it's good to have a master's. It gives you an edge. Of course, you don't need one to start working. You might start working and, equivalent experience might be okay. But I would say that most organizations today are recruiting at master levels and above. So yes, it is a good idea to do a master's, but don't wait until you can do a master's to start looking for opportunities in global and public health. You can definitely start, now today and do a master's later. That is absolutely possible. And you might have more clarity on what type of master's you want to do then. So thank you for that question. And then, how can we increase our chances in landing entry-level jobs as juniors with limited experience? I love this question. Yes, thank you so much for that. Okay, I'm going to challenge you on that limited experience. Yes, of course, you don't have the same experience of someone who's working 25 years in the field. Absolutely not. But you have experience. That experience comes from your studies. That experience comes from any volunteer jobs, from any sort of outside of the academic environment work that you've been doing, but also, if you are a leader in a students' association, if you're a participant in a students' association, what have you been doing there? There are skills that are transferable in what you've been doing all along throughout your studying years. So let's take a look. First, research skills. For sure, if you're doing a master's in global or public health, there are going to be some research projects that you have to be involved in. Those are direct experience. This is not the theoretical class where you're sitting down and just absorbing information. This, you're actually doing something. You're doing a research project, you're doing an implementation project, you're doing a health advocacy project, you're doing a health policy project. Whatever projects you've done as part of your master's, those count towards experience. Don't try to inflate them, right? Don't try to say, I have like 4 years of experience in health policy because I've been doing health policy projects in my studies. No, be realistic, but say, yes, I've been working in health policy. These are the skills that I have been using. And this is the type of project that we developed during my studies. That's experience. So make sure you highlight the experience from your studies in your CV. And in your cover letter. That's very important. And also any other experience. Have you volunteered? Yes, okay, I have volunteered. Or I have worked at a cafe, or I have worked, at a health clinic as a volunteer, or I'm a Red Cross runner, whatever it is, that teaches you important experience. It doesn't matter if it's not related to global and public health. It might have taught you people skills, communication skills, time management skills, organizational skills. What did you learn from that work or volunteering experience? Whether with an association that you worked for, whether because you were a student leader, whether because you actually volunteered for a small organization, whether because you were working with your mom or dad at their offices, whatever it is that you've done, what did you learn from it? And what transferable skills can you put on your CV? Don't only think global and public health related skills, think communications, people skills, organizational skills, time management skills, project management skills. What are you good at? Okay. If it's, like editing, I've been editing all, my peers are not very good at writing. So I actually go through all their writing and edited them. Or I've been developing great AI skills. Put all of that in your CV and cover letter. Yes, you have limited experience, but that experience is not zero. It's on you to pull out the experience from all your life and study experiences. Okay, so hope that answers the question. People joining from Nigeria. How do we get these hidden jobs? I think I've answered that question. There's different ways, but the three most important ones is build relationships with people working in organizations that you're interested in. Talk to your current network of professors, students, friends, etc., and figure out who works where and who knows who. And then use that as a warm lead to build more relationships. And third, volunteer, but volunteer smartly. Come with a solution to an organization's problem. Okay? Are there virtual remote internships that one should look out for? Yes, there are a lot of virtual and remote internships. I would say more and more. Many organizations now have gone completely remote. Not all, of course, but many have. And many have sort of like both, like remote and non-remote. I'm not sure there's a specific site where you can look at those, where those are collected. But normally now in many of the job positions and volunteer or internship positions, you will see that it says remote or remote, but based in such and such country. Okay, so that's a good place to go. And there is one website that I like that's called No Visa Jobs. It's not only for global or public health, but basically it's jobs that you can do from abroad and where you don't need a visa, because that is also something that can be really challenging, especially for people like me who come from developing country. I have applied for many jobs. However, most of my applications were either rejected or did not receive any email regarding the status of my application. Currently, I am the co-founder of Sahan Research and Consulting Center. I established this organization to find solutions for job seekers by equipping them with the skills required in the market. That's amazing. Our primary focus is on research and data analysis. That's great. See? Mohammed basically created his own job by building his own organizations. That's also something you can do. If you're looking to freelance, what skills should one leverage to get noticed, and where does one even start without getting into freelancing in the public health field? Freelancing, it normally is about consulting or providing technical advice, and there are many opportunities in this space. These opportunities look different. They can look as a project specific thing. So they're hiring you to get a project done. And then it's, the amount of money that you will get paid for is for the full completion of the project. So you need to be sure to complete those deliverables and get paid. The other option is a lot of organizations recruit consultants because they are not allowed to hire more staff. So they recruit consultants, but those consultants actually work as if they were staff. And this is normally per hour or per day. So it's on a per hour or per day fee. And in most, apart from the job security and the benefits, in most ways, it looks like you're part of the team and you're part of the job, etc., and you're working full time for a single organization. Whereas on a project based or a per hour based thing, or freelancing gig, you would have several, you would be working for several organizations at the same time. So there's this variety of options there. You need to have good communication skills, because this is about talking to your partner organizations or your clients or whatever you want to call them. You need to have specific skills that are useful for those organizations. So it really depends on what you want to freelance on. But the more specific you can be about that, the better. It's easier to advertise yourself, and you need to be willing to advertise your services. Otherwise, people won't hear about you, right? So you need to talk to people and say, hey, I can help you with this and this and this. And that can be uncomfortable because that's not what we're trained for in global and public health. So those are some of the skills that I think you need to have. As for where to look for these opportunities, many of these opportunities are also below the water, below the, in the hidden part of the iceberg. So you need to build those relationships. And if you work with someone in a particular organization in one department, make sure at the end of that project that you say, hey, if any of your colleagues in other departments need my skills, please, recommend me, or please, connect me with them so I can talk to them, etc. So make sure you get like that, a snowball thing going, okay? And as to where to look for these opportunities, many of these opportunities are advertised in the same websites where you can look for jobs. We'll share some resources about that later, about where you can look for jobs in these consulting or freelancing opportunities, as you're calling them. Will Alanda be holding internships for later this year? Yes, we change interns every 4 months. So Julius, correct me if I'm wrong, but I think the next one will be advertising in April. And many of the things you're learning today can actually help you get an edge on the internship position and on the internship application. Could I first repeat the first question briefly? I'm sorry, we don't have time for that, but there is a recording and we will be sharing the recording as of tomorrow. So you'll have access to the recording and to whatever I said at the beginning about the career options outside of academia. What hard skills would you say are a must for a young global or public health professional? That's a tough one. Soft skills, I don't like to call them soft skills, call them people skills, interpersonal skills. Those are the most important ones. Don't forget about those. Focus on those. On the hard skills, I'm not sure. It changes so fast, and it's changing so fast now with AI that I have a hard time making a guess. You need to be good at understanding. I think, some of the most important pieces that I see are missing usually is, we all talk about being more evidence-based, etc., but people are not as good at understanding evidence. So making sure you have good skills for understanding evidence, understanding, like that, meta-analysis and systematic reviews and randomized clinical trials are better than other types of data. Being able to, understand how to read that data can be very important. I feel that science communication is more and more important today because of all the disinformation out there around things like vaccines, for instance. In general, I feel that monitoring and evaluation skills are really lacking in global and public health in many smaller organizations, or even medium-sized organizations, or even some large organizations. So develop your monitoring and evaluation skills. If you want to work on implementation, make sure you become great at project and program management skills. So these are, some of these are sort of in between the soft and the hard side of skills. But I think today we're really living through a revolution from, what you can do with AI. So actually understanding artificial intelligence and how you can use it to improve your jobs without losing the human touch and the human understanding can be very valuable as well. I think, many heads of organizations or middle managers and so on are a little bit older people, and they might have, or I include myself, are having a bit of a harder time to figure all this out. So having someone who, understands it much more implicitly in your team can be very valuable. So there's a lot of changes happening, and we're not sure where we're going to land. But I think, there's technical skills that are still very important, but, always your people skills will be what in the end makes the difference, I think. So, also make sure that you're building your people skills. I am from Somaliland. It's very difficult to find jobs. What can I do to find freelance jobs? Yes, it's difficult. There's not a lot of remote positions. I would say that consulting can be an edge. And, there are a lot of things, there are a lot of organizations recruiting for projects in Somaliland where you will have, an advantage. So if you can look at those positions and bring out your advantage because you speak the language, because you know the country, because you know the culture, because whatever, then you have, a big advantage over other candidates, even if this is a remote thing that you're doing for someone in another country or for organization in another country. But I think all the things we've been talking about today about relationship building still apply, right? What professional careers can I opt for as a student in Masters of International Health and Social Management? If you were here for the first part of the question, I talked about the organizations. In terms of careers, it really depends what you want to do, right? And I think it's okay to spend some time figuring it out. One of the questions I get from my mentees is, how do I know where I want to do next and what I want to do next? I'm like, sometimes you need to try. Are you attracted to policy work? Do you want to work for a year or two in that and see if that's a good fit for you? Are you attracted to implementation work? Are you attracted to research work? Try and find what you're attracted to and then try it on for size for a bit. And if you don't want to try it on for size, use this relationship building skills to talk to people who have jobs that look in theory like the job you want, and then ask them questions to understand how their jobs actually look like in their day-to-day. You might be thinking it looks one way, but then they're actually sitting in front of their desks all freaking day typing away in their computer answering emails, and that might not be something you want to be doing. So make sure to talk to people who actually have a job that looks like your dream job before trying it on for size yourself. Just make sure that, whatever you thought that job looked like actually looks like. Thank you for your wonderful answer. I truly represent your pain. Oh, thank you. That's very kind. If we expect a period of underemployment due to the US funding disruptions, what kind of upskilling activities are most useful? I'm thinking of things like LinkedIn Learning, Data Camp, and Coursera classes. Are those valued by employers? I think so. I think the most, if this was me, if I had to choose about where I'm going to focus my upskilling, I would try to focus it on either building something myself and building my skills that way. For example, can I build a GPT using AI? Or, can I do the data camp and learn about data management or data analysis, but then do a project by myself or in conjunction with a professor or with a university and then showcase those skills. So what I'm saying is, it's great that you do the learning, but what is the practical side of that learning? Can you do something practical that you could actually put as experience in your CV instead of putting it as a course that you took in Coursera? You see what I mean? So yes, do those courses, but then think about, how can I practice these skills? And that is also a very good way to approach an organization, right? If you're willing to do a little bit of work for free as a volunteer, say, hey, I just took this course in Coursera. I want to practice my skills in whatever. I see that your organization has some databases that have not been analyzed. I'm happy to analyze those and produce a report for you for free. If you know, I'm happy to discuss my skills and how can this be valuable for your organization. Do you have 10 minutes to chat, right? And then you're actually doing the work, and you can put a line in your CV saying volunteer experience at this organization, and this is what I did for them. See what I mean? And then it's not just a course that you put at the end that it was taken in Coursera. So try to gain practical experience during this upskilling. That would be my best advice, I think. Oh, someone is saying that No Visa Jobs is currently on hiatus. I'll reach out to the founder of this on LinkedIn. Thank you for that. I don't know what's happening there. Julius is confirming that the next internship recruitment for Orlando is in April. How can someone with zero work experience become a consultant in this area? That is challenging. I would say if you want to become a freelancer or a consultant, it can be very challenging if you don't have experience. That is because most consultancy positions look for skills that they don't have in their team. Not all, but most. That said, you could start as a freelancer by doing research assistant, you know, but sort of like with a research assistant title. So even if you're a freelancer or a consultant, so you could become a research assistant if you have good research skills from school, from university. You could start at that level. And there's also freelancing positions or consultancy positions at that level for sure. Or you could start, you know, as a program officer. This tends to be very administrative work, but if you're very well organized, if you have great, you know, organization, you know, like if you're very good at talking to people and connecting people and answering emails and, you know, those sort of things, and keeping on top of things and keeping people organized, this can be a great position that you can freelance for. So there are some opportunities for consulting and freelancing at the very junior entry level. And it's also easier to do that by, you know, first volunteering your time directly with an organization by building these relationships. And then you're tapping into these options that are below water, I would say. There is still a lot of questions here. I am happy to go on. Just do people need to log off, or can people stay a little bit more? Then I can keep talking for another 10 minutes or so trying to answer the questions. Should we say? Okay, I'm going to do one more question, and then I'm going to talk about the Thrive course, and then I'll come back and answer the questions for a little bit while longer. And if I haven't come back to your question yet, don't worry. We save this chat, and then on our LinkedIn, we're going to be publishing answers to these questions as well as in our newsletter. So if you signed up for this webinar, you will be getting emails from us with answers to the question that we didn't have time to answer during the webinar. So we do try to get through all of your questions. We know it's tough out there right now. Okay, so let me stop there and talk a little bit about Thrive. So Thrive is a course that we developed at Tolanda based on the experience of working with all our interns over the years, plus all the mentoring experience I have with students from a variety of master courses in several different universities across the world. The Thrive course helps students and young global and public health professionals on how to build a meaningful career in global and public health. It touches upon some of the subjects that we discussed today, you know, what type of organizations exist, should I do a PhD or not, how do I, you know, tap into those jobs that are below water, but also some more common things about how does a good CV look like, what does a good cover letter look like. It has all of these components built out of the common questions that we keep getting again and again from young students and global and public health professionals. It's supposed to be done over 6 weeks, but you have, you know, access to it for as long as needed. So you can go over the video courses at your own pace. And it comes with a workbook. So that workbook, many of the things that I've been saying today, how do you start building your network? How do you start building those relationships? How do you start that requires a strategy. So that workbook helps you figure out what type of jobs and organizations are a good match for you, and what type, what do you need to research about them? How do you need to, what does your network look like now? Who can you reach out to? And sort of have a networking strategy that will allow you to tap into these hidden jobs. So it takes you by the hand, step by step. There's great, you can read the testimonials on the web page. Julius is right now typing the link for the course in the chat. Go take a look at it. This webinar might have been enough for you, and that's great. If you need more support, you can find great resources in Thrive. Some of the Thrive resources, because of the current situation, we're going to post freely available on our website in the coming days. So you will have access to those, and we will send some of those by email. That said, the course is paid, but it has a low cost because part of it is sponsored by Alanda. And we have fully sponsored seats for people who need them. So if you need a fully sponsored seat, there is a form that you can fill out. And the Alanda team looks at these requests, and then we'll share with you the link for a fully sponsored seat if you need one. Please be aware that there's a limited number of sponsored seats. So if you don't really need one, don't take up that spot. Leave it for someone who really needs it. Also, if you're able to sponsor someone else and this person needs this course to try and land a job, it's always great that if we can help each other out. So we're trying to make many of our resources freely available because of the current very tough situation everybody in global and public health is in. But if you need more hands-on support, if you need more, accompaniment as you go through these motions of trying to get a job, this Thrive course is what will help you land a job by using these alternative methods that we've been talking about here, and having a lot more clarity on where you want to take your career, because that will make your search a lot more narrow so you can put in more time and resources into getting the real jobs that you want. Okay, so that's about Thrive. Do check it out. And if you have any questions, feel free to email us with your questions. There's an FAQ on the website. And as I said, if you need a sponsored seat, make sure to fill out the form and we'll get back to you. We want to make this available to as many people as possible because of the current situation. We are at time. If people are happy to stay, I can stay for 5 more minutes and answer a few more questions. I see that people are not leaving, so I'm just going to go ahead and answer as many questions as I can. Is that good? Okay, awesome. Now, where am I at? Sorry, I'm just looking through the questions. Give me 1 minute. How would you deal with potentially having to take a pay cut? Would you negotiate salary for an entry-level position? If yes, to what degree? The pay cut question is very specific. It really depends on your current life situation. If you're willing and able to take a pay cut because, for example, you want to, move from medicine into global and public health, if you're willing and able to take a pay cut because you will be earning less, and you really want to explore that area, then this is definitely something you can do. That said, one thing that I absolutely teach my interns is you need to negotiate your salary each and every single time. And that includes your very first entry-level job. That even includes volunteering, right? You volunteer in an organization, they're not going to pay you, but what other benefits can you get? Okay. So, negotiating a salary is not just about the financial items. There's a zillion other things that you can negotiate about, whether you can work remote, whether they can give you a computer, whether they can pay your internet connection, whether, what type of benefits do you have? If it's a startup, can you get, a lower pay, but then you might be able to get, a participation in the company. So there's many things that you can negotiate on. I have a list about like 75. I'm going to try and find it. It was not developed by me, but we'll try to add this to the resources. But that said, yes, you need to negotiate even your entry-level salary. The reason most people don't negotiate their salaries is because they're afraid they're going to get rejected, right? They're going to say, oh, no, we don't want you anymore. The salary that you're asking for is too high. That's not going to happen. So you don't negotiate your salary until they have chosen you as a candidate. Once they say, yes, we want you, then you negotiate your salary, okay? Not before that. Second thing about salary negotiation, and we could have a whole other webinar on this, is you try as hard as you can to not give the opening number. So you let the organization give the first number, and then you hook yourself on top of that one. So in the end, you end up in the middle, okay? There's a lot of information about salary negotiation. Just type how to negotiate my entry-level salary on Google and read up on it. Type it on ChatGPT, and being old style, type it on ChatGPT and see what it has to say. But definitely do negotiate your entry-level salary. Remember, your entry-level salary is going to be the basis for everything that you're going to earn throughout your life. So that entry-level salary absolutely needs to be negotiated, okay? And don't only negotiate the financial aspect, negotiate all the other things around it that are important to you, okay? Many people, myself included, don't have the time or financial flexibility to do volunteer work or unpaid internships. What advice do you have for people in that situation? That is tough, and I understand it. In that case, you need to be even more focused on finding a job or a paid internship. There are specific websites for paid internships and for jobs, of course. And that said, what you can do is whatever job you have today that is paying the bills, try to extract as much experience and skills as you can from it. Whether you're working at a restaurant, whether you're working at the store, whatever it is that you're doing, how can you pull out the skills from that and advertise those skills in your CV? So yes, I understand this is not possible for everybody. And also remember that volunteer does not need to mean full-time. If you can volunteer even a couple of hours a month, that can be an important way of getting a foot inside an organization. So, think about, the spectrum. How is there any amount of hours at all that you could volunteer in a month? And, how can you use that to develop your skills and to provide value to the organization so you can get a foot in the door? That's how I would think about it. But I do recognize that this is not possible for everyone. There's an invitation to conduct a webinar on job hunting skills. I'll look into that, Mohammed. Thank you very much. I'm a fresh graduate from nursing science, but I'm interested in global health. I have over 5-year project management and leadership experience also. Please, can you share on how I can break into the global health space? This is brilliant. The thing is, people, let's forget about titles. It doesn't have to say global health in your title, in your master's, or in your whatever, for you to own that title. If you have good health experience, then you can say, experience in project management and leadership in the health space. And that might be the title that you need. You don't need to say that you're a nurse if that's not necessarily the right direction. But you might even want to say that you're a nurse, because we need nurses and medical doctors in public and global health. And many people in public and global health are nurses and doctors. So that's not a minus, that's a plus, and you can put it in your CV as long as your experience that has to do with talking to more than one person, to not necessarily your direct nursing skills on the patient level, but are you giving courses? Are you managing projects? Are you managing research studies? What else is there that you have done, that it's more closely linked to public and global health, but not necessarily to the, one-on-one care to patients level, okay? But definitely we need nurses, so don't hide that. That is brilliant. You have great experience there. Just bring it out in your CV. Kindly check the pin message. Yes, thank you. Thank you so much for your insights, Candela. This has been very encouraging despite the current barriers we face in global health. It is going to be a tough year, I believe. But just remember, whenever you're feeling frustrated because you can't find a job, every day I see on LinkedIn people that are advertising that they just got their next job. So every day people are being recruited, and that the next person can be you. You just need to put in the effort, the right type of effort. And by that, I mean, do not only focus on the top of the iceberg, okay? Great. I think I've gone through most of the questions. If I have not, feel free to send me an email, and we'll try and get those through via email or through our LinkedIn. Thank you, everyone, for staying a little bit over time and for being here today. I acknowledge it's very tough out there today. There are still open positions. There's a lot, things are going to get better. Other funders will come in and step up, and there will be new positions, and many of the work that has had to be stopped will resume in one form or the other. Take care of each other. Reach out to someone who might be having a hard time. Share resources. Connect to your peers. Let's stay connected. That's what's going to help us. Yes, it's going to be rough. Working global health is usually rough. We can get through this, and we can get through this together. Stay tuned for the recording. We'll send you an email with the recording and the link to the Thrive course. If you have questions, if you need more support, go take a look at that Thrive course. We'd love to see you in the Thrive course. We want to support you. And there's a lot of opportunities out there that could really use your talents. Keep reminding yourself from that. So let's onward with all of this. And thank you so much for being here. Well, you'll hear more from Alanda tomorrow in your emails. Thank you for being here and for asking all those amazing questions.